It may seem like the COVID-19 pandemic is basically over. Even President Biden indicated that in a recent interview. But health officials are cautioning that much as we might like that to be the case, it really isn't. So that means getting another Omicron variant booster shot is probably a good idea. And those vaccines are available. They're available for everyone aged 12 years and older who have completed their primary COVID-19 vaccine series or received their last booster or additional dose at least 2 months ago. And all people 6 months or older are eligible for the COVID-19 primary series vaccines, and those between the ages of 5 to 11 are eligible for the earlier rounds of boosters as well. We traveled down to Bennington recently to visit the COVID Resource Center set up by the Southwestern Vermont Medical Center, located at the former Southern Vermont College gym, where previous rounds of vaccines and boosters have been administered. There we spoke with Kathy Sleeman, the Director of Rehabilitation Services, to find out how things are going. Roughly, how many people on average are coming through every day that you're open here?
So since we have the new bivalent vaccine, we have about over 300 people coming in through the doors on Tuesdays and Thursdays. We're open Tuesdays and Thursdays, 8 to 12, and we'll be open on Saturdays in the month of October, 8 to 12 for vaccines as well as flu vaccines.
And are you getting an ample supply of the booster shots for the COVID?
Yes, we are. It has been discussions with the hospital and the state. The state will have Moderna and Pfizer, and pending on the numbers that they have, we will get them here and we're able to give them to the folks that want them.
And what should folks bring when they come here in addition to face masks? Just their history of previous vaccinations?
Yes, their vaccine card is helpful, and then any history or any medical concerns they can ask. We have nurses on site here giving vaccines and also can help with any questions that they have.
The new bivalent boosters became available in early September, but so far the pace of people getting the boosters is a little slower than the previous rounds. We spoke with Health Commissioner Mark Levine about how things were going in general with the battle against COVID and how the perception of the virus and resistance to getting vaccinated has evolved. What is your assessment of where we in Vermont now stand in relationship with the COVID pandemic? Are we kind of on the back end of this now, or, too hard to tell?
Yeah, well, that really gets at the issue of, is this still a pandemic or have we moved to so-called endemic? I think a lot was made of the president's statement. And while I don't want to be the one who interprets for the president, clearly the president was, I think, talking a lot about the impact of the virus on the population at large and where the population is, to his observation and many other observations, psychologically. So, what do we see now? We see that people are much more out and about than they've ever been before. People are being called back to the workplace rather than be in a remote posture. Schools are completely open, and the parents, the faculty, and most important, the kids are delighted that they're back in school. People are going to events again, whether it be a private wedding or whether it be a more public event, and they're traveling again, even using air travel at record numbers. So all of that tells us that no matter what words we use, psychologically, the population is moving on. Now, having said that, the definition of endemic is really when we're more in a stable state where we don't think we're subject to surges in disease activity anymore, where there's a bit more predictability. I don't think we're there yet by strict definition, and we do have to give it some time to allow things to sort of settle out. There's still 400 deaths a day in the United States. There are still thousands, tens of thousands of hospitalizations every day. Our rates of these are actually at a much higher percentage than we are a percentage of the world's population. So we still have concerns, obviously. I think in Vermont, we're doing quite well right now, to be honest. As you know, we don't have a wonderful way to measure new cases because PCR testing is sort of a has-been and not relied on as the go-to anymore. Antigen tests are informing people all the time about what they do and don't have, but they're not informing us all the time, so we don't have accurate statistics on that. We do, through the community level indicator of the CDC and our own use of that across the state, have a good sense for the fact that our healthcare system, while it's quite busy and being severely impacted by lots of people, is not being severely impacted by lots of COVID. The COVID as a percentage of their hospitalizations is quite low. Even people admitted who test positive for COVID often are not there because of the COVID positivity. They're there for a completely other reason, which is maybe a third to half the time COVID is the reason that they're there in the first place. So all of that together, and a very low death rate over the course of this month. We're almost at the end of the month, and we've had, thank God, only 4 deaths in the state. Tell us that things are going in a good direction. And I think people armed with the knowledge that they can test, armed with the knowledge that if they test positive, they have treatments, armed with vaccines, which are preventing those severe outcomes we just talked about, and knowing they can go back to anything that they used to do, whether it be avoid a crowd, wear a mask in certain settings. I think people are taking ownership of that and allowing themselves to sort of move on and try to coexist at a time when we're with this virus.
Are we seeing people in sufficient numbers, getting those boosters in a timely way, or is there still some foot dragging going on that you're perceiving? And how important is it, do you think, that people do remain up to date on their booster shots?
Yeah, so 28 days of this month has gone by, and that's almost as many days as we've had the ability to start vaccinating people with the new bivalent vaccine. And we're doing about 1,000 a day. So we're closing in on 30,000 doses administered already, which I think is quite good. This is a bivalent vaccine. It means it has a component of the so-called original or ancestral strain, and it has the newest BA4, BA5 Omicron strains that we're experiencing still right now. So it makes sense that there'll be, at least for a short duration, nice protectiveness against these newer strains. And over the long term, we're already aware that the original shot and the subsequent boosters continue to this day to protect people from the serious outcomes. So this vaccine has been tested. We've known that the safety profile is as good as it was in the prior versions of the vaccine. And we know that in a test tube, it shows that your body makes really strong antibody response against the virus. We're waiting on a little more clinical data that is yet to come because the vaccine was deployed as quickly as it could possibly be, just to reassure people that it is having the effect on these outcomes that we want it to. But there's really little doubt that it's going to, based on our previous experience. And as you know, with the flu shot, you don't ask every year that you get a flu shot, well, did it pass the test? Did it actually show it was effective and prevented these serious outcomes? That's part of what we accept about these vaccines at this point in time. So for the Pfizer, it would be age 12 and older. For the Moderna, 18 and older. We expect by mid-October that we'll have authorization for age 5 to 11 for the booster. But that's pending. But they're pretty confident, and they've already allowed us to order it. It just won't be delivered until it's been signed off.
Yes. Anything we should worry about in the near
Well,
future?
I'm in the camp that refuses to predict. I think there are too many pundits out there that want to say something, so they say things that get people afraid, like we're going to have a fall surge, we're going to have a winter surge. The true answer is nobody knows. This virus has really been unpredictable, had a mind of its own since 2.5 years ago when we first saw it for the first time. I would think that this is an unusual time. We were seeing one variant after another, as you know, for a couple years. Starting at the turn of this year, we saw Omicron. Everything we've seen between January and September has not been a new variant. It's been a subvariant of the original Omicron. So more mutations in the same kind of virus. And that's all we keep seeing. So that's why there's a steady flow of people who who continue to say, oh, I just had COVID. But at the same time, they're having it with a much different virus than in the pre-Omicron era. And we haven't seen a new variant either in this country or, what's more likely, in another country of the world that's been raising eyebrows. So all of that is quite good.
Again, anyone who is 12 or older is eligible to get the latest COVID booster, and you can also get your flu shot at the same time. There are many locations where the boosters are being given out. If you go to Bennington and want to get your vaccine or booster shot, the facility at the former Southern Vermont College Gym is open Tuesdays and Thursdays from 8 a.m. to noon. For the GNAT-TV News Project, I'm Andrew McKeever.